Dr. Ethan Carter was one of the top internal medicine doctors at a busy hospital in New York. People called him the Machine. Always on time. Always calm. Always in control. He moved from one room to another, one patient to another, one crisis to another, saving lives, stabilizing emergencies, prescribing treatments, and then moving on. He saw pain every single day, so he'd built a wall around his heart. He was kind, professional, and dedicated, but always a little distant. Until that day. A young woman in her late 20s was wheeled into his ward. Too pale for her age. Exhausted eyes but strangely full of light. Her name was Lily Parker. Her file said, Stage 4. Complications. Very low chances. He'd seen that diagnosis hundreds of times. Usually he didn't even flinch. But this time something made him pause. Maybe it was the way she looked at him. No begging, no breakdown, just a tired smile. "Hi, doctor," she said softly. "Looks like I'm your toughest case today, huh?" He raised an eyebrow. "You've been reading your chart?" She gave a small laugh. "When you've been sick this long, you kind of learn the language of hospitals." For a second, his professional mask slipped. There was something about her. Most patients either cried, panicked, or shut down. Lily was different. She wasn't pretending to be brave, she was brave. At first, he visited her like any other patient. Morning rounds. Vitals. Medications. Updates. Move on. But Lily refused to let him be just the doctor in the white coat. "Can I ask you something?" she said one evening when the sun was setting behind the city skyline, painting the hospital windows gold and pink. He checked her chart and replied, "Sure. Do you ever get tired of it?" "Tired of what?" "Of watching people hurt. Of telling families to stay hopeful when you know the odds aren't great." His pen paused over the paper. No one had ever asked him that so directly. He could have given her the usual speech. The textbook answer. The safe, surface-level line. But something inside him was tired of that too. "Yes," he admitted quietly. "I do." Lily smiled, not with pity but with understanding. "Then I'll make it easier for you. If it doesn't go well for me, don't carry it as your failure, okay? You did your best. That's more than enough." He looked up at her, really looked at her. And in that moment, the wall he'd spent years building around his heart quietly cracked. Days turned into weeks. Lily became more than room 514 or bed 2. She became the patient who asked how he was doing before answering how she was. She joked with the nurses, comforted other patients, and brightened every shift she was awake for. "Do you have kids?" she asked one afternoon. "Not yet," he replied, writing